Government and private insurance. People have several options for health insurance. The government offers health plans for specialized audiences. Medicare is mostly for people age 65 and older, with some exceptions. Medicaid is for families and individuals with disability or limited financial resources. However, most people get their insurance through commercial sources. They can purchase private insurance through an insurance company. And their health care is subsidized through premiums paid directly to the company. Another option is to get health insurance through employer. If these plans are self-insured by the employer, they tend to be lower cost because additional fees are not built into the premiums. The employers budget a certain amount for employees' claims, which employers pay as they come in. However, some employers purchase group plans for their employees. Now, these group plans are purchased from the insurance companies.
If the company does try to have the group plan.
Yeah, if they don't have self-insured plans, then they will buy from the group insurance. Another option is to get health care through employers, okay? And then the Affordable Care Act, ACA, has given individuals and families another place to go for health insurance. The Federal Insurance Marketplace opened in October 2013. The marketplace is designed to provide consumers with an online place to go to shop for health insurance. Consumers can compare plans in their area, get answers to questions, and find out if they are eligible for tax credits. Now, those tax credits which are available for private and some government insurance plans, and thus some states have marketplace set up where consumers can shop as well. The Small Business Health Option Program opened in 2014. Like the marketplace for consumers, SHOP provides small businesses with a streamlined opportunity to purchase high-quality health insurance for their employees. There is no open enrollment for this service, so small business employers can buy health insurance throughout the year. Now, premium. What is premium? Premium is a pre-established amount set by the insurance company and paid regularly, usually on a monthly basis, by the patient or an employer. The government insurance, Medicare. Medicare is health insurance provided to people 65 years of age or older. People younger than 65 with certain disabilities, and all people who have end-stage kidney disease. Now, Medicare has the following 4 parts. Medicare Part A provides hospitalization insurance, generally free of charge to individuals eligible for Medicare benefit. Healthcare services covered include inpatient hospital care, skilled nursing facility care, home health care, hospice care, and inpatient care in a religious, non-medical healthcare institution. Now, inpatient hospital coverage and the coverage for skilled nursing facility care are measured in the benefit periods. And the benefit period begins when the patient is admitted to the hospital or skilled nursing facility and ends when the patient has not received care for 60 days in a row. And there are certain limitations on how much coverage Part A pays for each kind of service. So under Medicare Part B, people can purchase voluntary supplemental Medicare insurance to help pay for the providers and other medical professional services, medical services, and medical surgical supplies not covered by Medicare Part A. The other services covered include are the provided at an emergency department or an outpatient clinic, such as the same-day surgery, home health care not covered under Part A, laboratory tests, X-rays, other diagnostic radiology services, ambulatory surgery center services at Medicare approved facilities, and most physical, speech and occupational therapy services, radiation therapy, kidney dialysis and transplants, heart and liver transplant, and inpatient hospitalization when Part A benefits have been exhausted. The services not covered by Part A or Part B include the following. Long-term nursing care, cosmetic surgery, dentures and dental care, acupuncture, hearing aids and exams for fitting hearing aids. So these are not covered under the Medicare.
So even the person get older, then he has to go to retirement house that they offer nursing to come and see him, right?
They offer what?
Like a person nursing care,
Yes,
long-term
temporary
nursing
is
care,
covered.
or temporary. So they can, if he's in the nursing home, the nurse can come see him still.
Right.
Oh, okay.
Now Medicare is federally funded health insurance provided to people age 65 or older, or people younger than 65 who have certain disabilities, and people of all ages with end-stage kidney disease. So that is what the Medicare covers. Benefit period is time during which the benefits are payable under a given insurance plan. A Medicare Part A provides hospitalization insurance to eligible individuals. Part B, voluntary supplemental medical insurance to help pay for the physicians and other medical professional services, medical services, and the medical surgical supplies not covered by Medicare Part A. And Medicare Advantage plans. They offer a combined package of the benefits under both Part A and B in some instances. They offer extra coverage for services such as vision, hearing, dental, and health, and wellness programs. The many also include prescription drug coverage and organizations offering MA plans must meet specific requirements for CMS. The following options are available through Medicare Advantage. Health Maintenance Organization, HMOs, allow the patients to only go to providers, other healthcare professionals, or hospitals on the plan's list of approved providers, except in an emergency. Preferred provider organizations. They allow the patients to use doctors, specialists, and hospitals in the plan's network. Going to doctors and hospitals not on the list usually mean that the patient will have to pay extra.
If you go outside that.
Yeah, if you go out of the network.
But HMO will allow you, except emergency.
Oh, yeah, only in emergency, but not otherwise.
Okay.
The private fee-for-service plans allows the patient to go to any doctor, other healthcare professional, or hospital as long as the provider agrees to treat those patients. The plan determines how much it will pay providers and how much the patient must pay for care. So that depends on the plan. People enrolled in Medicare may receive an advance beneficiary notice of non-coverage if there is a possibility that Medicare will deny coverage. Now, items that may fall into this category. They include certain Part A, hospice care or home health agencies, and Part B, outpatient services. And your office may send out an ABN if there is a concern that the Medicare won't cover a particular service. If the Medicare usually pay for that services, or if the Medicare may not consider the particular services medically necessary for a particular patient in a particular plan. So this form also may be used to alert patients to services that Medicare never covers. The Medicare specialty plans, they provide focused, specialized healthcare for specific group of people, such as those who have both Medicare and Medicaid. So live in a nursing home or have chronic medical conditions. And Medicare Part D pays for medications. The drug benefit is run by private insurance companies and other vendors approved by Medicare. And there are many plans to choose from, and they can vary in cost and drugs covered. The beneficiary can choose the plan that best meets their needs. So there are so many plans. Each one, they are different costs and they are different medicines, all covered. Some are more and some less. Out-of-pocket expense. Mostly come up for people who choose the fee-for-service option. And they are responsible for charges not covered by Medicare, as well as the various cost-sharing requirements of Part A and B. These expenses may be paid by Medicare beneficiary and employer-sponsored health or the Medicare. A private health insurance that pays for most of the charges not covered by Part A and Part B. If a beneficiary is eligible for Medicaid, it could pay for some of the outstanding expenses not covered by Medicare. So Medicaid covers them. Now Medicaid, this is government-based health insurance option. It is funded through partnership between state governments and the federal Medicaid. So this Medicaid is funded by federal and the state government. The program pays for medical assistance for individuals who have low income and limited financial resources. To participate in Medicaid, must meet national guidelines established by the federal laws, regulations, and policies. If the states meet those requirements, they qualify for federal matching grants. Each state has its own agency that determines Medicaid eligibility for its residents. And Medicaid policies vary from state to state, so a person eligible in one state may not be eligible in another one. However, the federal government has established that the following are considered categorically needy eligible group. And they are those who meet requirements for temporary assistance for needy families, children below the age of 6 whose family income is at or below 133% of the federal poverty level, and pregnant women whose family income is below 133% of the federal poverty level. Supplemental security income recipients in most states, recipients of adoption and foster care assistance, individuals who lose their cash assistance due to earnings from work or increased Social Security benefits, infants born to Medicaid eligible women, and certain low-income Medicare recipients. Now, what is Medicaid? A government-based health insurance option that pays for medical assistance for individuals who have low income and limited financial resources. Funded at the state and national level and administered at the state level. Services covered under Medicaid. To receive federal matching funds, Medicaid must provide medical assistance for the following services: inpatient hospital care, outpatient hospital care, emergency care, parental care, vaccine for children, provider services, skilled nursing facility services for persons aged 2 or older, family planning services and supplies, rural health clinic services, home health care person eligible for skilled nursing services, laboratory and X-ray services, pediatrics and family nurse practitioner services, nurse midwife services, federally qualified health center services, and ambulatory services performed at federally qualified health centers that would be available in other settings. Early and periodic screening, diagnosis, and therapeutic services for children under age 21. They are also covered. State also receive federal matching funds to provide some of the following option services: diagnostic services, clinic services, prescription drug and prosthetic devices. You know prosthetic? Prosthetic is artificial limbs. They remove, they put the artificial wooden ones. So those are called prostheses. That is prosthetic device. Transportation services, rehabilitation, and physical therapy services. Home care and community-based care services for people who have chronic impairments. Now, state children's health insurance program. This program is also jointly funded by federal government and the states. State must meet the following 3 eligibility criteria. Number 1, recipient must come from low-income families. Recipient must be otherwise ineligible for Medicaid, and recipients must be uninsured. The state must offer the following services: inpatient hospital care, outpatient hospital care, the provider's surgical and medical services, laboratory and X-ray services, well baby child care, including age-appropriate immunizations. The state children's health insurance program is a program jointly funded by federal government and state to cover uninsured children in families with most income to high to quality for Medicare. Commercial insurance. The term refers to 3 kinds of insurance: individual, employer-sponsored, and employer-based self-insured. Individual insurance plans, they are paid for by the individual, while employer-based self-insurance is tied to the individual's place of employment, and both kinds of commercial insurance are explained in the following section. Individual health insurance plans. These plans are paid for through the premiums, which are a pre-established amount set by the insurance company and paid regularly, usually on a monthly basis. The premium of all the plans participants go into fund, which is used to pay for claims. And for paying a claim, the company reviews it accurately, carefully, to make sure that the service is covered by the plan. They also check for the diagnostic codes to make sure the services were medically necessary. Payment is made to either the provider or the policyholder. Upfront information provided to policyholders before signing on a plan include the following: what medical services will be covered and when the company will pay for those medical services, how much or for how long the company will pay for the covered services, and which process must be followed to ensure that the covered medical expenses are paid. Moving forward, some patients may say that they have plans through Obamacare, which they really mean is that they purchased a plan through a carrier such as Aetna or Blue Cross and Blue Shield on an ACA market. These plans will likely fit a managed care model. The managed care refers to a plan that provides care in return for post. The scheduled payments and those coordinate healthcare through a network of primary care providers, hospitals, and other providers. The next section describes the 2 most common type of managed cares: the health insurance maintenance and preferred provider organization. Now, health maintenance organization, which is HMO, they provide comprehensive health care to an enrolled group for a fixed period of time. Some of these plans are by capitation, meaning that the provider is paid a fixed amount for each individual enrollment in the plan, and during a specific period of time, regardless of expense or nature of the service provided to the patient. There are pros and cons to manage care. The pros are that the healthcare costs usually are contained, established and the fee schedules are used. Authorized services are compensated. Okay, and the patients are out-of-pocket expenses tend to be less than they would be with additional insurance. And the cons are that the access to specialized care can be limited, and physician choices in the treatment of patients can be limited. The paperwork can be greater and the treatment might be delayed due to pre-authorization. For these reasons, it is important for the medical system to understand which services are covered, which are not, and which require special form of billing. And with the information in hand, the medical administrative assistant can explain covered benefits to patients, and that will step two. That must have been taken to for procedures and services requiring approval. Preferred Provider Organization, which is called PPO. Under this model, an insurer representing client, an individual or a business, they contracts with the group of providers who agree on a predetermined list of charges for all services. And these include both the normal and complex procedures. Unlike HMO, PPO have no capitation or prepaid care. These plans usually have deductible and co-insurance payments of 20 to 25%. The insurance then pays the bills. Now, providers like this model because it preserves the fee-for-service approach, where the provider is reimbursed for the care given. And when the patient is covered under the PPO plan, the provider treats the patient and bills the PPO.
In a way, HMO is sometimes good, sometimes
Sometimes no, yeah.
they limit you, but PPO also.
They used to have no network for PPO, but
Yeah.
now they all have networks.
Yeah, it's better if they have network.
Yeah. Still, some people like HMO and some like PPO. The choose provider subscriber are given a list of those in the network. Rates of those providers are typically lower than those out of the network. Therefore, the patient goes to an out-of-network, the out-of-pocket cost will be higher. Employer-based self-insurance plans. The idea behind employer-based self-insurance plan is that the companies save money by self-insuring their employees. Health plans rather than purchasing coverage for medical, for the private
I know
insurance.
with self-insurance, so because they take from your check, that's the self-insurance.
Right, they set a
Certain
amount, set some amount for the insurance
So
expenses.
the expenses that means you are
Yeah, they take the money as just like the premiums
Yeah.
from the employees.
Yeah.
And they keep putting in one account
Uh-huh.
and they keep saving it there.
So they don't
Okay,
have
and
to
they
purchase
use
coverage.
as the people comes.
That comes okay. That they don't have to
If
put it
somebody have a claim, they use that money.
down. Okay.
So they keep adding every month's money in that plan
Mhm.
and they keep using as needed. Okay? The only thing is they don't have overheads like the other big companies.
Yeah.
So that's why their plans are cheaper.
Cheaper, yeah.
Yeah, but then again, if the companies want to save more and more money,
Yeah.
they buy the cheaper plans then. They give you less benefits than the other insurance company.
So when the employee builds self-insurance, it's a self through the employer, but
Yes.
you pay from your pocket.
Right, exactly. You buy it from instead of buying it from the insurance company, now you're buying it from the employer.
From the employer, okay.
You pay him premium
Yeah.
and he gives you the health insurance. Self-insurance costs are lower because additional fees built into the premiums by private insurers are eliminated. Because they have so many other expenses.
Expenses,
They
okay.
put it in the big pool and calculate the premium then.
Yeah.
Overheads are too much in the insurance companies. Employer-based self-insurance plans vary in their design and what services are covered. Many have a cost-sharing feature, which expenses are shared with employees and are taken out of their paychecks each pay period. But because of economics of scale, the cost of employer-based health insurance plans tend to be lower than those of the purchased by individuals. The plans usually are funded through the administrative services only. Contracts between the employer and the private insurers. So the employer pays for the insurance,
Yeah.
but they have somebody else who's managing the insurance for them.
Oh, okay.
Because somebody have to manage it.
Yeah.
It's not going to be managed by itself. Now, under these contracts, employer fund the plans themselves and the private insurers administer the plan for the employers. Blue Cross Blue Shield plans. Now, these plans were the first prepaid plans in the United States. Originally, Blue Cross covered the hospital care and Blue Shield covers the provider services. They merged to form a Blue Cross Blue Shield Association in 1982. Now, BCBS, also called the Blues, include more than 60 independent, locally operated companies with plan in 50 states.
So it's the first one, huh? Blue Cross?
Yeah.
It must be a rich company.
Right. They started as a non-profit organization.
Oh.
So they have plans in 50 states, District of Columbia, and Puerto Rico.
So now Blue Cross also now, even though Medicare pay for you, so when you choose Blue Cross, like my dad, he choose Blue Cross, he have Medicare.
Yeah.
65
No.
older, he have Medicare.
Right.
And
People,
he choose, they send him Athena plan, Meridian, Blue Cross, whatever.
right.
He choose Blue Cross. So those companies still getting even they go get from either company or from
The
government.
Yeah.
They still
Government
exist.
they still exist. Yeah.
So what's the purpose of like now changing the insurance plan? Because even with the Obamacare, they're
Mhm.
still involved in Blue Cross.
Right. Obamacare is the guideline.
The guideline.
Okay. So they cannot go out of those.
Oh, okay, there's a guideline.
Right.
No. Now when I was a Trump, it will change, right? But still, those private Blue Cross, all these
See,
things
they are.
exist.
Remember, we read the certain
Policies,
things before.
Yeah.
They were not before in the insurance company.
Yeah.
And when Obamacare,
Ah,
which is ACA,
AC.
Affordable Care Act,
Mm-hmm.
they put more options in there that you cannot pre-existing conditions,
Yeah, I cannot deny them.
deny them.
So this company, Blue Cross, and everything was accepted.
They will accept. Yeah.
They will accept all
Yes.
that. They don't
yeah,
deny
all the
you.
rules will be
All
accepted.
accepted. Okay. even though they okay because they get through from the government, they
Right.
get paid though. Yeah,
All the rule apply to all insurance
so all
companies.
insurances.
Doesn't matter government or non-government.
Okay.
So they offer health insurance to individuals, small businesses, senior or large employer groups. The federal government also has a large program called the BCBS Federal Employee Program. They also have the Medicare through Blue Advantage.
Mm.
That's Blue Cross Blue Shield Medicare Advantage program. Now, how does the government help with health insurance? The government provides Medicare, Medicaid, and the state children's health insurance program, and offer health insurance options on the market through the Affordable Care Act. What is the difference between individual health insurance and the employer self-insured? The private health insurance is paid by individuals or employers in the form of premiums to the insurance company. Employer self-insurance plans are purchased in bulk by the employer and are generally most cost-effective. Additional costs embedded in premiums are largely eliminated, and the employers fund the health insurance plans. Often, employers enter into agreement with private insurers to manage the plan. So they fund the plan, but some other insurance company or some other medical group
Mhm.
manages it,
Yeah.
because there's a lot of work.
So the premium, the company take from your out of your check, and then they pay the premium, whatever they deal with
Yeah.
you, all the policies and everything.
Yeah, instead of paying to the health insurance
Yeah.
company,
Yeah.
they put those funds in a
Mhm.
set account
Mhm.
and save them for the future use.
Yeah.
They keep using as the bills comes, they keep using. Okay, so that's the difference between those two. Pre and post instructions for testing and procedures. Medical administrative assistant often are asked to arrange outpatient diagnostic testing and procedures. The testing can include magnetic resonance imaging, computed tomography, scans, X-ray evaluations, ultrasound testing, and blood testing. The possible procedures include dilation and curettage and biopsies. When setting up appointments for diagnostic testing or procedures, take the following steps. Obtain a written order from the provider. That is the first thing.
Okay.
Because without working order,
Mhm.
nothing can be done.
Mm.
So that describes the exact procedure to be performed. If a referral is needed, make sure you have a copy of that. And this paperwork provides the necessary documentation for the test or procedure. Now, if the patient's insurance requires pre-authorization, make sure to take care of this pre-authorization. Now, pre-authorization involves notifying the health insurance plan that the patient needs a procedure, giving the insurance company the opportunity to determine whether the procedure is medically necessary. And this will ensure that the insurance benefits are valid and will cover the patient's medical needs.
So they have to authorize it.
Yeah. Make sure the patient is available at the time the test or the procedure has been scheduled. And if the provider needs to be there, make sure that she is available as well. If it is a surgical thing, it has to be, both of them have to be there. So make sure both of them are available. Confirm that the diagnostic facility is in the participating providers with the patient's insurance company. They are in the network. Then call the facility and schedule the patient's procedure or test. And remember to follow these steps. Order the tests, provide the patient's diagnosis and orders. Establish the date and time for the procedure. Give the patient's name, age, address, telephone number. Provide the patient's demographic information, including identification and insurance policy numbers, as well as the address for filing claims. Determine any special instructions for the patients or special anesthesia requirements. Notify the facility of urgency for the test results. Let the patients know about the arrangements. Make sure to inform the patient of the following: name, address, and telephone number of the facility. Date and time to report for the test. Instructions for preparing for the test, including eating restrictions, fluid requirements, and whether medication should be taken. Information about pre-admission testing. The need to bring a form of picture identification and insurance card to the facility on the day of the procedure. Whether the patient needs to pick up orders or whether they will be forwarded to the facility in advance. After going through the list, ask the patient to repeat the instructions. Also remind the patient of the importance of keeping the appointment and arriving on time. Have the provider review the consent form with the patient. And the patient should sign the consent form and a copy should be placed in his medical record. And this process will ensure that the patient understands the risk, benefit, and alternative to the procedure. Document the information in the patient's chart and then check the patient's status following the procedure. And make sure the patient is following the provider's post-procedure instructions. And follow up with the facility if results are not received properly. So summary, the patient has a key role to play in his or her healthcare. And this chapter identified what the patient's rights are and emphasize the importance of explaining these rights to them. All patients, including those who have disabilities and language barriers, must be told of their rights in a way they can understand. With the rights, however, come responsibilities. The chapter also explains the patient's financial responsibilities, which usually are in the form of co-payments, co-insurance, and deductibles. The chapter ends with a discussion on the steps that must be followed to schedule procedures and tests and inform the patient of what he or she need to do before and after the procedure. The next chapter will revisit many of the ideas we have already discussed, but from the perspective of office practices that need to be performed on a regular basis. And that's it.
If the patient have that's the time like language barrier they have, that's what the translation and stuff.